All right. Good afternoon, everyone. I'm really glad to see all of you here today. My name is Aditi Skandan, and I'm the founder of the International Achievers, which is an initiative focused on making career exploration more accessible for students. And a lot of the processes behind building a career, making decisions, and finding the right opportunities isn't clearly explained in a lot of places. And because of that, I feel that it's really hard to figure out things by yourself as you go. And that's exactly why I created sessions like these. And through the International Achievers, the goal is to bring in people who have actually gone through these journeys and can share honest insights and the thinking behind them. So today's not about learning just to become a doctor, but really understanding what that path looks like in a real way. And it's truly a privilege to introduce our speaker for today, Dr. Sapna Rajput. She is a board certified family medicine physician and the founder of medical director of Mountain View Primary Care Medical Clinic here in the Bay Area, and she brings in years of experience caring for patients and is known for her thoughtful approach to medicine that focuses on understanding the whole person. And we're really excited to learn from both her experiences and her perspective today. Additionally, please feel free to leave questions in the chat as we go. Dr. Rajput, thank you so much for being here today.
Thank you so much, Aditi. Nice to meet everyone, and thank you so much for having me. Today, I'd like to make this as interactive as can be, so please feel free if you do have questions while I'm on a slide. Please feel free to chat with Aditi on Zoom, and she'll interrupt me and ask me those questions. I think it's easier that way, so you don't forget your questions by the end of the presentation. So I'll go ahead and start presenting. So this talk is more about, if medicine is right for you, and just exploring different parts of medicine, the pathway to medicine, what a typical day looks like for a physician, and how do you find out if this is the right path for you? So a little bit about myself. I'm, again, Dr. Sapna Rajput. I'm a family medicine physician, and I'm very local. I was born in Fremont, and I lived in Union City. So I attended public schools in Union City from K to 12. And then I went on to UC Davis and got my Bachelor's of Science in Genetics. And then I earned my DO, which is Doctor of Osteopathic Medicine. I will go over that later in case anyone doesn't know about that. But I earned my DO at Midwestern University in Chicago. I completed my family residency at Stanford O'Connor in San Jose. And 20 years later, here I am, and I started my own clinic about 1.5 years ago in Mountain View. It's called Mountain View Primary Care Medical Clinic. And I built it because I had a vision of how I wanted to take care of people and patients, and just wanted to have more control over the vision and taking care of my patients. So let's start with reasons to pursue medicine. One of the reasons is that you genuinely care about people. You don't want to just do a job, but you want to help in a very meaningful way because you will be absolutely a part of their story. And so you love interacting with people, you love listening to them, understanding why they are the way they are, understanding obviously their medical concerns, and just having that genuine empathy. Another reason is you like solving puzzles because every 15 minutes we see a new patient. And it's like having a new project in front of you every 15 minutes. And it's like solving a puzzle. So you're gathering information, you're asking them questions. In your head, you're trying to strategize and see what further questions to ask, what the diagnosis is, and how to treat it. So a lot of it is like solving a puzzle, which is actually can be very engaging and very motivating if that's something you like to do. Loving to learn is definitely a reason to pursue medicine. Science and medicine is constantly evolving. And what I learned maybe 20 years ago when I was in residency has changed now. And so as a physician, you have to keep on track with new research, new medications. And as a board certified physician, you will have to continue to take exams throughout your career, pass the board certification test. You also have to do continuing medical education to continue with your license. So you're constantly learning. So if you like learning, this is a great field to go into. Another thing is you're curious about the body. So you really want to know, how does the body work? How does the heart work? What is really going on a deeper level? If you are interested in that, obviously this is a great field to go to. You'll be learning most of those things in medical school, and maybe when you're in college if you choose a science major. And the other thing is you're okay with hard work. So being a physician is difficult in the way that you will have to be putting in many hours of studying. You'll be constantly learning. You're going to be continually being challenged. And you're okay, say, waking up at 5 a.m. to study because you have a test the next day, or you're okay studying for months for your MCAT exam. So as long as you're okay with hard work, this would be a good choice for you as well. Now, there's two paths to becoming a physician. One is MD, which is allopathic, and the other is DO, which is osteopathic. So MD, as most of you know, stand for medical doctor. And the pathway is very similar. So for an MD and a DO, which is a doctor of osteopathic medicine, the training is 4 years of medical school. And then afterwards, you'll be joining a residency program. And the residency program is where you delve into your field, your specialty that you're interested in. And as an MD or a DO, you can go into the same residency program. Now, the main difference between a DO and an MD is the training in a DO field focuses more on a whole person, holistic approach. It really emphasizes preventative care. And also, we learn to do osteopathic manipulative treatment. An abbreviation of that is OMT. And what it is, it's understanding how the body's structure affects function. So the DO doctor can go ahead and diagnose a patient by talking to them, but also examining different parts of their body and coming to a better conclusion of what could be going on, and then treating that by what they've learned as far as maybe manipulating different body parts, putting different vertebrae back in function, etc. So most of physicians are MDs. There's about 11% of physicians in the US that are DOs. So again, OMT, again, it's a hands-on technique, and it's used to treat the body's muscles and joints to improve movement and relieve pain. Any questions so far before I go on? Is there been anything in the chat?
Yes, there has been a question about how someone doesn't know how to pursue what they're exactly good at because they feel like they're better at math, but they really like science, and they're trying to ask you how you decided you were able to or capable enough to pursue medicine.
So I think you don't have to have just one interest. You can definitely have many different types of interest. And for an example, I went into UC Davis and I chose biology as my major. And I ended up switching that because I took genetic classes, and I was just so enamored by genetics and figuring things out. And so I ended up switching to genetics because I found, well, that's what I'm really interested in. As well, I ended up taking an engineering math class. I didn't need it for pre-med. I didn't need it for medicine, but it was just something I was interested in. I'm not good in math anymore, but at that point, I was very interested in it. So you can really, if you love math, you can do math alongside science. There's not a problem with that at all.
Yes, I think it's more about exploring your interests and at the same time really trying to figure out what you're good at and what you'd enjoy doing every day. So I
Right. And
think
so I'll get to that as well, as far as how you can help figure out what you're interested in. As far as what makes medicine worth it, it's the real direct impact that you have. There's very few careers where you can help someone and have them feel better the same moment or the same day.
yeah,
So you can help them breathe easier. You can help them walk again. You can help them feel less pain. You can help their mood. There's just so much of a um, reward in seeing what your work has caused. Like you see that someone's happier. You see that they're able to walk again. You see they're able to breathe. So there's not many careers where you can see that direct impact right away. The other thing with medicine is that you don't have to be a physician. There's so many different fields in medicine. So you can be a physical therapist, you can be an occupational therapist, you can be a nurse practitioner, you can be a nurse, you can be a physician assistant, you can be a medical assistant. There's so many different pathways for medicine. And so that's really wonderful as well. So if you feel that one pathway isn't right for you, you have the potential of changing, even if you're still interested in medicine. And the other thing is having it kind of goes to back to number one, but having meaningful relationships. So your patients will trust you in their hardest times. Again, like I said earlier, you become part of their story. And that is it's really nice to know that every day you've had an impact on somebody and you're part of their story in a positive way. And then also resilience and growth is huge. So as you go toward your pathway of whether it's becoming a physician or another career in the medical field, it's going to push you. You are going to have many challenges. There are going to be very stressful moments. You will make hard decisions, but that will all help you grow as a person and become more resilient.
thank you. And we do have another question in the chat from Priya, and she wanted to understand if psychiatry also falls in the same category. I think she's talking about your slide about the MD and DO.
Yes, absolutely. For psychiatry, you can you can be an MD or a DO. Yes.
Thank you.
And we do need a lot of psychiatrists. There's definitely a need for therapists and psychiatrists in the field. So um, just to make you aware of that. Okay, so again, like we talked about medicine and how it can be the right fit for you, but it doesn't have to be, and that's okay. It's not for everyone. Some ways to figure out if it's not for you is one thing, you're science averse. You just really don't like biology. You don't like understanding how the body works. You're just not interested in problem solving about science. And I'm not saying it's challenging for you or it's hard for you. I'm saying you just don't like it and you're not interested in it. There's a big difference between it being hard and challenging versus it being something you don't enjoy. So what I'm talking about is if someone does not enjoy science. Also, if you're someone that doesn't really like being around people, you don't feel comfortable with emotional conversations, you don't feel comfortable with hard conversations, then it may not be the field for you. Some physicians that do want to work on their own more do go into radiology. So that's the field that you can absolutely go into. But at the same time, it's something that you can learn to be comfortable with. So how we are now doesn't really predict how we're going to be in the future all the time. And as you get more experiences and you shadow different doctors and you're involved in more, You may surprise yourself, and you may be very comfortable talking to people, and you may love having these deeper conversations. The other thing is if you want a quick path. If you want to go to college and then have a job right away, this is absolutely not the field for you. If you want to be a physician, you're going to go to college for 4 years. You're going to go to medical school for 4 years, and then your residency is going to be 3 to 7 years long, depending on the field that you choose. So it's not a shortcut career in any way. And then if you're doing it mainly for prestige or money, it's a very long journey. And if you do only do it for prestige or money, it's going to be very hard to stay happy because it's a lot of work and you have to have that passion, that deep passion to be a physician. Another thing is if you want or need strict work-life balance early on. As a doctor, you can get that, absolutely, but that's going to often come later than earlier. So after you've had some experience, you're a doctor, you've worked for a while, then you can go into a field where there's more balance. You can choose your hours, you can work part-time, you can work 2 hours a day, you can just do video calls if you want. So at that point, there's so much flexibility and balance is possible. But in the beginning, that's when you're really working hard and getting the hours in. And again, if you don't like long-term commitment, because this is a long journey and you're going to be putting your time and effort into it. So it does require a lot of patience.
Thank you, Dr. Rajput. And there are a couple more questions in the chat as well. Anu is asking, what's the difference between dentistry and medicine in general?
Yeah, so the dentistry track is a completely different track than being a physician. So a physician is a medical doctor, whereas a dentist is a dentist. You go to dental school for being a dentist, whereas to be a physician, you go to medical school. So there are two different pathways. For dentistry, you're focusing obviously on the oral aspect, the teeth, the gums, etc. And for being a physician, you're focusing on the whole body.
Thank you. And there is another question from Arya, and they're wondering how AI is affecting medicine right now and how you feel it would change in the next 10 years. I think this is a really interesting question because I personally feel like there are a lot of issues with AI ethics now as well, so it's definitely going to change.
That's a really, really good question. That can probably be a talk on its own. But to give maybe a quick summary, just so I can get through the other slides as well, is in my day-to-day life, AI has definitely been a part of medicine. So in the past, we used to have medical scribes, or we would have to write down our charting notes on our own after we see every patient. So charting note, what that is, that's when you actually summarize the entire visit and you have documentation on what you did. Previously, we would have to do that on our own, write down the patient's whole story, the exam, the assessment, and the plan. And now, when we go in a room, we can have an AI scribe that listens to the patient and physician conversation. In the end, they summarize the whole thing in detail. You cut and you paste it into your note. Obviously, you'd want to review it as well because AI is not perfect and can hallucinate. So in that way, it's made things easier. And it's definitely very, charting is very time consuming. So that's given us more time back. And then there's also different AI platforms where you can look up at medical information for if you're a physician. So if you're a physician, you can log into this AI platform and they can help you figure out what's going on with the patient. Again, it is something that you have to cross-check. You can't rely solely on AI and you have to use your medical knowledge and look up sources that you know are the right sources. But AI, yes, is going to be a big part of medicine, but it cannot take place of that human connection. So I think more than anything, when I see patients personally, I feel like just our conversation can be healing, or just the way you the way you talk to someone, the way you show your empathy, the way you interact with someone is in itself so healing. And I do not think that AI can take that away at all. So I think there will always need to be that human touch, that human connection to heal somebody.
Yes, definitely. Because I feel like a lot of people, even I, was kind of worried about how AI might take over even the field of medicine, since that didn't seem that possible before, even with robotic surgeons right now. But I do think human connection will always be an important part of medicine. So,
Right. And there's a lot of nuances. So when you examine a patient, you touch them, you feel them, you get so much information versus putting in their symptoms into a computer and having them spit something out where they tell you what it is. There's nothing that can replace, oh, your heart sounds like this, you have an irregular rhythm, you have a murmur in your heart, your lungs don't sound good. I don't see how AI can take that place. Maybe it can. I'm sure there's other tools that will be there in the future, but for now, still need doctors. Okay. Anything else?
there is another question from Gayatri, and she's asking us to please specify some other professions in medicine other than being a physician, because their student is intimidated by the commitment for med school and unsure since they're still a high schooler.
Yeah, so like I said earlier, so different there's so many different fields in medicine that you can go to into. You can be a nurse practitioner, you can be a physician assistant. That's when you can see patients on your own under the supervision of a physician. You can be a nurse practitioner. A nurse practitioner can see patients on their own and prescribe medications. You can do physical therapy, where that's more rehabilitation, hands-on rehabilitation for musculoskeletal disorders. You can do occupational therapy. There's so many different speech pathology. There's so many different fields that you can go into depending on your interest.
Thank you.
Okay, let me just go back to my slides. Okay, so I put this slide in because I think I've seen there's a lot of pressure on kids as well, sometimes from their parents telling them that they have a choice. You can either be a doctor or you can be an engineer. I went through that myself growing up, where I was given two choices. One was an engineer or a doctor. And I went through a lot of different thoughts at the time. I personally wanted to be a teacher or an actress or a singer or do something in the arts. And my parents, your parents know you in a way that no one will know you. And my parents said, no, I think you'd be good as a doctor. And so I did take their guidance. And the first thing I did was I said, well, let me see, let me go volunteer at a hospital. And back then that was called candy striping. You wore these gowns that were striped white and red, and you looked like I don't know, a candy cane. So it's called candy striping. And so I would volunteer at the hospital every Saturday. And I realized, wow, I really like this. I really like helping people. I really like putting a smile on their face. It really connected with me. And then I just started doing other types of volunteer work. I was part of a volunteer club and got many volunteer hours just to see, well, I know I like helping people. Is it that I like helping people just by doing something in the medical field, or maybe is something else interesting for me? So I did a lot of volunteer work elsewhere. And in the end, it came to be, yeah, I really like helping people through medicine. So I think it's really important to listen to your parents, and to get their guidance, because they're doing it. They know you in a way that no one else will know you, and they're doing it out of love. At the same time, you have to have a balance. you have to see if it's something that you're very passionate about. You're the one that will be studying, training, and building this career for your years to come. So it has to follow your interest, your strength, and your goals. So just be open and definitely explore and decide then what feels right for you. And there's many ways to be successful. There's many ways to help others and many ways to make yourself proud and your family proud. But for medicine, you want to do it because you have the passion. If you don't have the passion, it's going to be a very difficult road.
Yes, like you said, I think exposure is really important because if, for example, I didn't try out specific activities, I would never know what I'm truly interested
Right.
in.
Right.
And I think just figuring out by watching either videos or learning about things is helpful, of course, but really experiencing and taking part in certain activities does really help a lot.
Right. And being a physician, that doesn't mean that's your only identity, right? So I did Bharatanatyam when I was younger. I loved dance. I loved doing speech and debate. I loved arts and crafts. And so I continued to do all that into medical school. I would perform Bharatanatyam at my medical school. So it's really important to have those as well and to have those hobbies because you do need a balance as you're going through the process. And my parents told me, well, Sapna, if you look at it, dancing and arts and all these things that you're interested in, those can be hobbies and those can be always something that you can do on the side and that will be there for you. But their advice was to guide me toward a stable and respected career, which I very much appreciate now.
Yes.
All right. So one question I saw there were some questions about what major do you have to become a doctor? So you do not have to major in science to become a doctor. You can major in any field that you want to. Most students do choose science because that's what they're interested in, and that's why they're going into medical school or want to go to medical school, but you don't have to. Medical schools do require prerequisite classes, pre-med requisite classes that you have to take. So while you're in college doing whatever major you do have to fulfill those prerequisites to apply to medical school. Some of those are like biology, inorganic chemistry, organic chemistry, biochem, physics, etc. So there's not a specific major that you have to do to become a doctor. Again, like I said, mine was biology and I switched to genetics. So you can always switch to, as you go along, you get exposure and figure out what you like. Any questions on that one? Because there were several questions on the
Yes.
list of that.
Thank you for asking. There are a couple of questions. How does one decide between private practice versus group practice given the challenges of smooth transition of referrals?
Yeah, so that's definitely something that I went through. So after I graduated from residency, I started and worked at a big multi-specialty group. And I didn't really understand, in medical school, they don't teach you the business side of things, or in residency, you don't really see the business side of things. So I didn't really understand what it was to go to a big multi-specialty group. It looked like that's what everyone was doing. So I'm like, okay, I'll go ahead and do that too. And I did, and I quickly learned it was not the right fit for me. It was the right fit for many people, but not for me. And so I was at a point where I didn't know what to do because I thought that was the only thing I could do at that point. I didn't have much experience. How could I start my own private practice? I didn't know anything about the business side. And so I reached out to my residency program director who gave me different ideas, one of which was to go into occupational medicine. So occupational medicine is basically treating workers. So treating workers that get injured on the job. And I actually ended up doing that for 10 years. And I learned that, wow, I actually really like it. As a DO, I got to do a lot of treatments of musculoskeletal conditions because a lot of these patients were construction workers, or they would do things where they fell down and they got injured with their bones or their muscles. And I really experienced the passion for that. I also learned how to take care of eye injuries, how to stitch someone up, like so many things that I wasn't comfortable with before. And then I, at some point, that turned into a bigger company buying out this smaller company. So it was me in the position again of being in a larger group. And I realized, again, that's not the right fit for me. There were things that I didn't like, one of which was, I have to see so many patients in this amount of time. I couldn't spend time with patients that I wanted to. I didn't have the control of how I wanted to take care of patients. And then eventually, I got into working at a clinic employed by another private practice doctor, and realized that, wow, I really, really enjoy that smaller setting. I really enjoy the family feel of it. You get to know your patients by their names. You can have the flexibility if someone says, hey, I'm sick, not feeling well today. Well, if you don't have room in your schedule, you have that flexibility to say, hey, just come on in. I will squeeze you in between patients. Or the flexibility to say, oh, you know what? I know this patient has a lot of issues. They're going to take a lot of time. I'm going to block off 30 minutes for this patient, so I'm not rushed to see another patient. So I realized that was the right fit for me, and then started my own practice. And so I didn't know I was going to start my own private practice during any of this process. I actually thought I was just going to stay where I was last, but then I opened this practice, and I could not be happier. So again, it's exposure. It's going through different experiences and finding what you like and what you don't like.
Yes, the experience is really interesting because it really shows that any career, in fact, is not really a linear path, and that we have to try so many different activities and places before finally figuring out what we truly like. And maybe we still don't
Exactly.
find out what we truly like.
Yeah, and you don't have to, which is the great part of it. Whatever decision you make, it's not permanent, right? You can always change it. So never feel that you have to make the right decision and it's going to be the decision you're stuck with. I have made many decisions that I've changed, and it's taught me so much. And I'm at a place where I think I always wanted to be, how I envisioned medicine as a teenager, and what I thought it would look like as being a doctor. I'm
Mhm.
there, but it took 20 years to get there,
Yes.
So
Yeah. And there are a couple more questions. Someone's curious about the path to becoming an ophthalmologist.
right. So ophthalmology is also a medical doctor or a DO, so MD or DO. So it's the same path. You go to 4 years of college, you do your 4 years of medical school, you apply to ophthalmology residency. And I would have to look up how many years ophthalmology residency is, but you would go through those 4 plus years. I'm not sure how much it is offhand.
And another quick question. Does a nurse practitioner, physician assistant, and an occupational therapist go to med school too?
No, they don't. They go to their corresponding schools. So, as a nurse practitioner, you would go through nursing school. As a physician assistant, you would go to physician assisting school. So, each has their own pathway.
Okay. Thank you.
Okay. Oh, where is my. Okay. Okay, and then there was another question regarding pathway in the list. So I thought I just, put this out there. I don't think it's something that anyone really needs to think about right now in middle school or high school, but just to, so you can get to know a little more. So a strong GPA and MCAT scores are very important. Again, that is in college. So you'll be taking your MCAT in college, and your grade point average is the college GPA that they're looking at. They're also looking at your direct patient exposure, your service, your volunteering, leadership, extracurriculars, and you'll be writing a personal statement. So when you do that, you want to be able to describe an experience. They want to know, well, why do you want to be a doctor? And there has to be a reason behind it. And so those exposures will give you your own personal reasons. So it's not just GPA and MCAT, it's looking at you as a whole person. How do you know if medicine is right for you? So I would say definitely get the experience. So one of the biggest thing is shadowing physicians, seeing what it really looks like. You can read about it, you can listen to people talk about it, but you really can't know about it till you experience it. And I would say to shadow different specialties. So say you shadow a physician, but they're in surgery and you realize, oh my God, I don't like seeing blood. I can't stand for like 8 hours a day doing a surgery. That doesn't mean you're not fit for medicine. Look at another field, look at family medicine, look at ophthalmology, look at other fields, different environments, clinic environment, a hospital environment, underserved clinics, they're all very different. And you might find your own passion when you look at different environments. And very similarly, volunteering in the healthcare settings, working or interning in a clinic if you're a high school student, and then just talking to doctors. And don't feel intimidated by doctors. When I was young, I was very intimidated talking to doctors. But just have candid conversations and, ask them how they feel about their career. Honestly, what's the good? What are things that they wish they didn't have to go through? What are the challenges and what are the rewards? And once you finish your day shadowing, reflect on it. Say, is this something that I would want to do every day? Is this something that will get me up in the morning? Definitely take time to reflect on it because it is something that you will be doing for the rest of your career if that's something you choose. Again, you don't have to. You can switch careers, but if you do choose to stick with it.
There is another question related to this topic about majors and pathways. If a student starts in a pre-med pathway and then decides to change course after getting an undergraduate degree, what are their options if they don't want to continue to go down to med school?
Oh, there's anything you want to do at that point. You would just have to meet the prerequisites for whatever field you want to go into. So if you've met the prerequisites for medical school and you don't want to go to medical school, you need to kind of reflect and say, okay, I don't want to do this. What do I want to do? And if you think, oh, I want to be a PA or an NP, or I want to do something different and be a lawyer or engineer, just make sure that you have gotten those prerequisites done and apply to those schools. There's nothing that should stop you from being able to do that.
Yes, thank you.
Okay, and then why shadowing matters. So just a personal story. Ever since I was little, I thought I wanted to be a pediatrician. I loved kids. And then I was in UC Davis and I volunteered at, I did some research project about patient-physician communication. I ended up going to a pediatric ward on the hospital and I realized I wasn't, it was definitely more emotionally difficult than I expected, taking care of very sick children. These are children that had cancers and other diseases that were very serious. And I realized, wow, I always wanted to be a pediatrician, but I always thought of it in a way that I'd be seeing kids that were healthy and maybe they were sick, but nothing too serious. And I realized at that moment, no, this is not for me. And I wouldn't have known that unless I got that experience and I shadowed and I got that real world exposure. Now, as far as shadowing, it's really important to be professional when you shadow. Definitely, when you reach out to physicians or whatever field you want to go to, respect your time. The reason I'm mentioning some of this as well is because I've had students where I feel that it would have been helpful if someone guided them through this. So another thing is don't go on your phone during your shadow time because then it feels like you're not interested and the doctor or mentor there is taking the time to be with you. So if you want to be on your phone, stay home. Dress appropriately. And if you're not sure how to dress, just ask them for a dress code. They'll be more than happy to help you with that. And just remember, in a small practice, you represent the practice. In a larger practice as well, when the doctor goes in, whoever's going in with them is part of that appointment. So be professional, be kind, ask how you can help. I just wanted to give some guidance because I feel like that's maybe not given in high school. So just something to think about. And the other one is, how do you find volunteer or work opportunities? Now, this one can feel a little daunting and hard, but the best thing is be proactive and don't give up. So reach out to clinics, hospitals, doctors, call them, email them. If you don't hear back from them, that does not mean that they don't have time or space for you. It probably just means that they're really, really busy and they did not get a chance to return your call or check their email. You can always ask the office staff. They're usually the ones that will arrange the days that students can shadow and help the doctor do that in their schedule. So you can always speak with the office staff when you're reaching out. And again, if you don't hear from them, it's not a no usually. It's just that they haven't gotten around to it. And definitely be persistent, but professional in it, and keep following up. The students that have shadowed me are the ones that are followed up because the day gets so busy that we don't mean to not respond, but sometimes it just can slip by. So keep at it. Don't feel you tried once and that's it. Keep trying.
Thank you. Yes, there was another question on the lines of volunteering opportunities, so I just wanted to get it covered. They're asking us about any specific or interesting activities to explore their interest in the medical field, not necessarily just shadowing or volunteering.
Say that again, specifics in how to get experience?
Specific ways to explore their interest in the medical field.
Right. I mean, what comes to the top of my head is mainly shadowing, speaking with doctors, being in that setting, working in a hospital. You have to kind of be in that setting because if you do things outside of the clinic and outside of the hospital, you'll get an idea, but it won't be the typical day in the life of a doctor or whatever it is that you want to do. So I can't think of anything else offhand that would really give you that correct exposure to it.
Yeah. Does lab and research experience also help a lot to explore your interests?
Yeah, it can. So, and when I was in UC Davis, I did research because it felt like if you were going to medical school, everyone did that. So I also did research and I just did not like it. I knew it wasn't for me. It was, again, and that's another thing you learn, right? I was like, I can't stay in the lab, not talking to people and just being with this petri dish all day. And that was just me, right? Because I needed to interact with people. So, but some people loved it and they were geniuses and they were able to really figure things out, which I always looked up to. Again, that's another thing, yes, that can help you decide if you wanted to go to research in the medical field or you want to do, if you want to interact with patients.
Yes, thank you.
Aditi, are we running out of time? Or
We
do
have
people
10
have
more
notes?
minutes.
Okay.
I think we don't really need a specific Q&A session since a lot of people are just giving and putting their questions in chat as we go.
Okay. So again, this is a day in the life of a physician. So there's many things happening throughout the day. I'm just going to go to the next slide. So there's every 15 to 20 minutes, you're seeing a new patient and trying to figure out like a puzzle, what's going on with them, how to treat them, how to make them better. Some may be more complex and require more hand-holding or more attention. So you have to be prepared that, wow, this patient's going to take 30 minutes. Now I'm 15 minutes late to my next appointment. how am I going to plan my day now? So you have to be okay with that. Again, there's a lot of problem solving in between patients. You're going to be reviewing their laboratory reports of labs that have come in, x-rays, imaging studies, results throughout the day. There'll be messages from patients that come in throughout the day that you'll be answering. And typically it's done between patients, which is a little bit hard because you only have 15 minutes per patient. So you're kind of running, oh, do I have a message? Does the patient have a question? Do I have a lab result in that I've been waiting for? Do I need to get a hold of a patient? The other thing is documentation. So that's after every patient, you're going to document the whole story. You're going to document the story, the history, the exam, the treatment, the diagnosis, and the plan. And that's probably one of the hardest admin works because it does take time. Again, like responding to messages, refill requests, a lot of unexpected situations. Maybe someone will come in your office and, one time I had a patient come in the office and she had seizures on my sofa in the office. And so anything can happen. One time my MA was doing an EKG, and while she was doing EKG, she herself fainted. So again, so many different things can happen that you have to be able to handle, and you will be able to handle it with the experience that you get. And then there was a lot of questions about uncertainty. So it's okay if you don't know. That's part of the journey. To know right now exactly what you want to do, I think it's a big ask. And so if you're interested in science, then you can go into science as a major and then slowly get more experience and decide if medicine is what you want to go into, or research, or something else. There's going to be uncertainty in every part of your journey. For me, for example, after medical school, you go through a match, and that's when you pick your first choice, second choice, and third choice of where you want to go to residency. And the residency program picks their first, second, and third choices of their candidates. And I was lucky enough to match into my first choice. But then in my first year, the residency said, oh, we're going to shut down. So again, I wouldn't even know that would be something that could happen at that point. But we had no idea as residents what would happen next. We started applying to different programs. We stuck in there. We kept, going to our residency program. In the end, it all worked out. Someone else took us in. And, we just transferred hospitals a couple times and we were okay. But just to give that example, that nothing in medicine is guaranteed. And the path, as Aditi said, is not linear in any way. Focus on what you can control, do your best, and accept uncertainty. So when you feel uncertain, just say, I accept it, because there's no other way. You're not going to be sure of really anything, especially in a field like this that's so competitive. It's hard to be sure of anything. But I can tell you that if you want to be a doctor, you will absolutely be a doctor. I went through a lot of challenges. I thought I wasn't going to be a doctor many, many, many times. But if you have the passion and you want to do it, nothing is going to stop you. Nothing. So keep at it. And if you need a pep talk, call me.
Thank you so much. I feel like the residency program story was definitely really interesting, because I heard that you said a different program took you in. So does that mean the people who shut down, they were not responsible for the residents anymore?
Yeah, correct. They were no longer part of our residency program. They weren't responsible anymore. Luckily, another hospital decided to take us on for 6 months. And then we got taken in by O'Connor, who said that they will go ahead and have the residency program there.
Wow.
So we got really lucky, but it was a very uncertain time.
Yes.
In your first year of residency, you got your first choice, and then it's almost taken away from you. But
Yeah.
all the residents just kept going and kept working hard, and it all worked out.
Mm-hmm. So
It
perseverance
always
is
does.
important in
It
this
always
field.
works out for the best. Even though at that time it may feel like it's not, it in the later on you'll realize it works out for the best.
Yes.
Again, there's no right choice. You can always change your mind. You can only the only thing you can do is make the best decision you can. Sometimes there's no right or wrong, and if it doesn't feel right, you change your direction, which I have done many times in my career. And you don't have to get it perfect. Just keep going. I think we're almost done. Sorry. Quickly, don't choose medicine because it sounds impressive. Just explore it, experience it, and choose something that fits you. And for me, the best part is when a patient tells me that I've made a difference. No matter how big or small, there's nothing like that. It makes everything worth it. So my contact is there. My website is there. If anyone needs to reach out to me, my contact information is on there. And I hope this was helpful. I'm happy to talk to anyone anytime. And if there's any more questions, please let me know.
Thank you so much, Dr. Ashraf, for this webinar. I feel like there were so many things that even I learned right now. For example, I really didn't know the difference between an MD and a DO. And I didn't know that occupational therapists didn't need to go to med school. So that was definitely a new insight for me. And I think a lot of people are really happy with the session as well. So thank you so much, Dr. Rajput,
You're awesome.
share your journey.
Welcome.
And thank you to everyone who joined as well. I hope this session really did give you a sense of clarity and reassurance as you think about your own paths. Through the International Achievers, we'll continue to create spaces like these where students can learn from real experiences and make more confident, informed decisions. And I really hope to see you at our future sessions. So I hope everyone has a great rest of your day. Thank you again.
Thank you.
Thank you, everyone.